What's new for Women's Health Connection and your patients when it comes to breast and cervical cancer treatment and access to Medicaid? I'm with the Nevada Cancer Coalition, and I'm going to share some exciting details with you. Let's get started. The big news is that more women now have access to enrollment into Medicaid for treatment of breast and cervical cancer. Women's Health Connection has removed barriers to accessing cancer treatment for Women's Health Connection eligible women not screened or diagnosed within the safety net program. Let's start with a little background or refresher on Women's Health Connection. Women's Health Connection is Nevada's name for the National Breast and Cervical Cancer Early Detection Program, a federally funded safety net program established by the CDC through a congressional act in 1990. The act was passed in response to an increase in the number of low-income and uninsured women being diagnosed with breast cancer. The program provides low-income, uninsured, and underserved women access to timely, high-quality breast and cervical cancer screening and diagnostic services. Nevada Division of Public and Behavioral Health received funding through the CDC to implement this program, which, as mentioned, we call Women's Health Connection. The Nevada Division of Public and Behavioral Health partners with Access to Healthcare Network to administer the program throughout the state. 10 years after the National Breast and Cervical Cancer Early Detection Program was established, Congress passed the Breast and Cervical Cancer Prevention and Treatment Act. This act gave states the option to provide medical assistance through Medicaid to eligible women who were screened and found to need treatment for breast or cervical cancer or precancerous conditions. Now women screened and diagnosed within the Women's Health Connection program could gain access to treatment as well. Other eligibility requirements for Medicaid still apply, such as for citizenship and residence status. We'll cover those details in the coming slides. Women's Health Connection provides a number of breast and cervical cancer screening services to women, including Pap tests, screening mammograms, clinical breast exams, and HPV tests. Diagnostic testing is provided if a patient's screening results are abnormal, and referral to treatment is provided if necessary. Women's Health Connection administrators also provide case management to program patients. We'll start by noting that Women's Health Connection is a safety net program in place to help patients with no other option. Patients should be navigated into other payer sources if they qualify. If a patient does not qualify for other payer sources, she must meet the following guidelines in order to be eligible for enrollment in Women's Health Connection. A woman must be 21 to 64 years old and a Nevada resident. She must be at or below 250% of the federal poverty level. The current figures for 250% of federal poverty level are available on the Access to Healthcare Network website in the Women's Health Connection section. A woman must also be either uninsured or underinsured. Underinsured is defined as having either insurance that doesn't cover cancer screening or diagnostic services, being a Medicare beneficiary and not having Part B, or having health insurance with an annual deductible, monthly spend down, or copayment that is high enough to prevent the patient from obtaining cancer screening services. If you are unsure if a patient's underinsured status meets the enrollment eligibility criteria, contact Women's Health Connection. In Nevada, women diagnosed with breast or cervical cancer or high-grade cervical precancer through the Women's Health Connection are fast-tracked through enrollment into Medicaid. The fast-track process reduces the application down to 2 pages and confirms enrollment within 1 to 5 business days. Once enrolled in Medicaid, the patient can remain enrolled through the duration of her cancer treatment. Her coverage under Medicaid covers all personal health care needs in addition to cancer treatment. However, her eligibility and enrollment applies solely to her. Spouses and children are not eligible to access Medicaid through this special enrollment eligibility. Other Medicaid rules and eligibility requirements still apply. So what's new in all of this? Administrative changes have been made within the Women's Health Connection program and the new language notes. Women who have been diagnosed with breast or cervical cancer or high-grade cervical precancer and are eligible and enrolled into the Women's Health Connection program, but did not receive their screening or diagnosis within the program, can have their diagnosis confirmed by a Women's Health Connection provider and immediately move forward with Medicaid enrollment through Women's Health Connection to receive treatment. We'll describe the steps of how this language change works in the next few slides. There are several benefits to this change. It eliminates the need for women to be rescreened and re-diagnosed by a Women's Health Connection provider to receive the Medicaid treatment option. This change removes a barrier to treatment for eligible women not screened within the program and speeds time from their diagnosis to treatment by eliminating rescreening and re-diagnosis procedures. Additionally, the change saves screening and diagnostic funds within the Women's Health Connection program, allowing for more women to receive services from the program. Now, let's go through how the referral and Women's Health Connection and Medicaid enrollment process works for patients not screened and diagnosed within the Women's Health Connection program. If a patient is diagnosed with breast or cervical cancer or high-grade cervical precancer and doesn't have access to treatment, first to determine her eligibility for the program, the patient must meet criteria for Women's Health Connection and the additional Medicaid eligibility requirements. If eligible, the provider can either contact Access to Healthcare Network or refer the patient to contact them directly and initiate enrollment in Women's Health Connection. A side note, all providers are also required to report the cancer case to the Nevada Central Cancer Registry. In the next step, a Women's Health Connection coordinator will enroll the patient in Women's Health Connection and assist her with completing a Medicaid enrollment application. The coordinator will then schedule the patient for an appointment with a contracted Women's Health Connection provider to verify the diagnosis. The patient should bring her existing pathology report, including diagnosis, to the appointment, as the verification relies upon these materials. No additional diagnostic procedures will be performed, simply a verification based on existing records. Next, the contracted provider will send verification of the patient's diagnosis to Women's Health Connection. To note, this provider will also report the cancer case to the Nevada Central Cancer Registry. Moving along, a Women's Health Connection coordinator will submit the already completed Medicaid application along with required documentation to the Division of Welfare for processing. Once approved, a Women's Health Connection coordinator will inform the patient and the provider of Medicaid approval and provide the patient's billing number. The patient can begin accessing treatment using this provided billing number. She will receive a Medicaid card within 7 to 10 business days. Women's Health Connection enrollment and care coordination will cease once the patient has enrolled in Medicaid and has a start date for her treatment. So those are the basics of the new expanded access to breast and cervical cancer treatment through Women's Health Connection and Medicaid enrollment. We're sure you have a few questions, so let's go through some of the frequently asked questions. Joining me is Dina Miguel, Preventive Care Director at Access to Healthcare Network. Dina, this new opportunity for enrollment and corresponding process was developed to remove barriers for access to treatment and reduce time from diagnosis to treatment. Approximately how long does this enrollment process take from the initial patient contact to Access to Healthcare Network and Women's Health Connection through finalizing enrollment in Medicaid? Once the patient has called us, we try to schedule the confirmation appointment and get the Medicaid application filled out within 24 to 48 hours of her call. We have had women call us on a Wednesday and say, I'm starting treatment this Friday morning, and we have all the steps completed and she's ready for treatment by Friday morning. Dina, my next question is, why are women enrolled in Women's Health Connection through this process rather than directly into Medicaid? Good question. In Nevada, the special access to Medicaid for breast and cervical cancer treatment is only offered through Women's Health Connection. In essence, the program is a gateway to Medicaid. Additionally, because we need to send the patient to a Women's Health Connection contracted provider for the verification of diagnosis, we must have her enrolled in order to compensate the provider for that visit. Next up, how long does a patient have to enroll in Women's Health Connection and this special breast and cervical cancer Medicaid after her initial breast or cervical cancer diagnosis?
Presumptive eligibility begins the date on which the contracted provider determines the patient meets Medicaid requirements, and if the patient does not file an application for assistance by the last day of the month following the month during which presumptive eligibility was determined. For example, a patient diagnosed with breast cancer and determined to be eligible for enrollment in Medicaid through the Women's Health Connection program on June 15th must apply for enrollment in Medicaid through Women's Health Connection no later than July 31st.
We mentioned previously that Medicaid enrollment eligibility still applies throughout this process. How can women who are undocumented or not legal residents get access to treatment for breast or cervical cancer?
Nevada Medicaid requirements, including citizenship and resident status, must be met in order to receive breast and cervical cancer treatment through Medicaid. For eligibility requirements, refer to C100 General Eligibility Requirements in the Medicaid Medical Assistance Manual. For those that do not meet Medicaid eligibility requirements, there are several options available for treatment. Access to Healthcare's Network's medical discount program provides uninsured residents with access to medical treatment at greatly reduced prices. The program is not health insurance, as members are expected to pay discounted rates for treatments at the time of service. Members must live or work in Nevada and meet income guidelines. More information is available at accesstohealthcare.org. Women from Mexico can contact the Mexican Consulate's Ventanilla de Salud for referrals and assistance in identifying treatment options. In Nevada, the Ventanilla de Salud office is located in Las Vegas. The Governor's Office of Consumer Health Assistance, also known as GovChaw, can assist patients in understanding hospital and provider bills, locating resources, negotiating discounts, or setting up payment arrangements.
We'll include information on each of these organizations in our links and resources section at the end of this webinar. Additionally, visit nevadacancercoalition.org to search an online resource directory. Up to this point, we've only mentioned breast and cervical cancers and high-grade cervical precancers. Can women diagnosed with other gynecologic cancers, such as uterine cancer, that don't have access to treatment coverage, use this special enrollment opportunity to receive Medicaid treatment?
No, unfortunately, the Women's Health Connection and corresponding Medicaid enrollment for treatment are limited to breast and cervical cancers and high-grade cervical precancers only. Women diagnosed with any other cancer are not eligible for the program. Enrollment and sisters and care coordinators at AHN can assist ineligible women in evaluating options for covering the cost of treatment, such as through AHN's medical discount program, enrollment in an insurance product, or some other financial assistance resource.
At the start of this webinar, we highlighted that enrollment in Medicaid through this process could continue as long as a patient is receiving active cancer treatment. What is considered active cancer treatment for enrollment purposes?
Active cancer treatment includes surgery, radiation, chemotherapy, and hormonal treatment specific to the cancer diagnosis at initial enrollment. A patient can remain covered by Medicaid for the duration of this treatment, including up to 10 years while receiving hormonal treatment such as with tamoxifen. To maintain coverage, the patient must be receiving active breast or cervical cancer treatment through a Medicaid provider and renew her enrollment in Medicaid annually. Medicaid will send a notice of renewal about 2 months before the renewal date. Please refer to C100 General Eligibility Requirements in the Medicaid Medical Assistance Manual for ongoing eligibility information.
What happens when the patient completes active cancer treatment?
Once the patient's provider indicates that treatment for the cancer is complete, the patient's enrollment and eligibility for Medicaid coverage will cease at the end of the month in which treatment ends. The patient can re-enroll in Women's Health Connection to resume regular breast and cervical cancer screening. She can contact Access to Healthcare Network to determine if she meets eligibility requirements and to initiate enrollment.
For an eligible patient not screened or diagnosed within the Women's Health Connection program, can she receive reimbursement through the program for the cost of her screening and diagnostic services once she's enrolled in Medicaid?
No, Women's Health Connection is only able to cover the cost of screening and diagnostics for patients enrolled prior to screening.
And one last question, Dina. When a woman is enrolled in Medicaid for breast or cervical cancer treatment, can she also gain Medicaid coverage for her children or spouse?
No, Medicaid enrollment through Women's Health Connection and a breast or cervical cancer diagnosis is for the diagnosed patient only. Her children and/or spouse are not eligible for enrollment or coverage in Medicaid through this special enrollment opportunity. The children and/or spouse of the patient must meet the standard eligibility requirements for Medicaid or Nevada checkup in order to enroll. For eligibility requirements, once again refer to the Medicaid Medical Assistance Manual. Kristen, I have a question for you. Why do the diagnosing providers need to report the cancer case to the Nevada Central Cancer Registry?
Good question, Dina. All healthcare providers who diagnose or treat a patient for cancer are required to report the patient's cancer diagnosis and/or treatment details to the Nevada Central Cancer Registry, as required by Nevada law NRS Chapter 457. The term healthcare providers includes but is not limited to hospitals, ambulatory surgery centers, laboratories, radiation facilities, oncology facilities, and physician offices. We'll provide information to learn more about the Nevada Central Cancer Registry and how to report cases in just a few slides. That brings us to the end of the discussion about the new enrollment opportunities for women to receive breast and cervical cancer treatment through Medicaid. Dina, thank you for joining me. How can viewers learn more about Access to Healthcare Network and enrollment in Women's Health Connection?
Thanks, Kristen. Viewers can visit accesstohealthcare.org to learn more about Women's Health Connection and review eligibility criteria and income guidelines. They can also call us at 844-469-4934.
We have a few more resources and links to share. Here are URLs for the Nevada Medicaid Assistance Manual and the Nevada Central Cancer Registry. You can also find these links in the notes below. Here are links for both Ventanilla de Salud and the Governor's Office of Consumer Health Assistance, or GovCHA. Program information for the Women's Health Connection is available on the Nevada Division of Public and Behavioral Health website. The program staff works out of Carson City. And finally, download additional resources and materials related to this webinar in the Healthcare Providers section of NevadaCancerCoalition.org. You can also send us questions or comments about this webinar or other breast and cervical cancer resources. And access the resource directory included on the website to search for patient resources, including support groups, financial assistance, and more. Thank you for joining us.